Nora, when you think about your work and who you've supported, who is it that receives care coordination? Is it for everyone?
Good question, Erica. So presently, care coordination is available for members of 4 major Medicaid managed care plans in the state of Ohio. Those managed care plans are CareSource, Molina, Buckeye, and United. We also work with members of the CFC, ABD, or AFK populations, which in other words, that's families who are covered by those 4 Medicaid managed care plans with children up to age 19, clients with disabilities up to age 21, or children in county custody or foster care agencies.
Mhm. So our family is here in North Carolina, actually, and we are seen at Duke Children's Hospital, Duke University Children's Hospital, and have experiences with care coordination. So I'm thinking maybe outside of an Ohio or someplace, are these services that families in general could receive or could expect, or what should you do if your doctor's office doesn't provide care coordination and integration?
Mm-hmm. Yeah, great question. I think really care coordination is growing across all of the United States. Many different hospital systems and doctors' offices have, I think, increasingly, we have found programs that are similar to the Partners for Kids program in Ohio, if not the actual Partners for Kids program. So right now, with us being specifically in the state of Ohio, we have a community team. We're actually actively working to branch out to all corners of the state and make those connections with different doctors' offices that are not necessarily with Nationwide Children's Hospital. My recommendation would be for anyone in the state of Ohio going to Nationwide Children's Hospital, not going to Nationwide Children's Hospital, or in any state across the country, which is just to ask your doctor, hey, do you have something like a care coordination program that you might be willing to refer us to? And if they are confused or not really sure what you're talking about, my next recommendation would be to call your managed care plan member services. That phone number, it's typically on the back of your insurance card, and ask them if they offer a care coordination resource.
That's a very good recommendation. I know in our case, it was at a point of crisis for the transitioning phase that my child was in with his disorder. And quite simply, in great frustration as a parent trying to pull all the pieces together, asked the administrative assistant who was trying to get me scheduled for yet another appointment, is there anyone that can just help me pull these pieces together? I am overwhelmed. And thankfully, she put me in touch with the licensed clinical social worker who was a part of their referral program. I don't know the formal name for it there at the Duke Center, but really changed our family's trajectory. So I think your recommendations definitely align to the way I entered into this space as a parent who was overwhelmed and needed some support, just pulling all the pieces together. Ask the office, ask the person on the front lines. Thank you for that.
Mm-hmm. Of course, yes. And, I think too, at the very basic level, sometimes there are so many different providers involved or agencies involved, just like your experience, Erica. And it can become exhausting as the caregiver to repeat yourself over and over and over again. And just to bring everybody onto the same page. And with care coordinator, I think really at the basis of all of this, it can be someone who can help to not only share that information on the family's behalf and keep everybody else organized, hopefully really help the caregivers save time so you can do more important things, right? Like like care for the little ones. Do what you need to do as a caregiver. Get some of your time back, and then also not have to feel like you're the only one advocating for your own family.